Hey guys, it's Dr. Travis McDermott, Vegas vet here with another surgery video for Surgery Saturday. We are once again happy to be in the operating room with Dr. Sean Cottle. Today we have Shadow, and we're going to do a tail amputation on Shadow, and Dr. Cottle is going to explain why we're doing that.
So this guy came in because he has a chronic case of what we call a happy tail. Basically, he's always excited all the time, tail's wagging back and forth, banging into things, making it bleed, never has a chance to fully heal up. So what we're going to do today is try and help with that. Basically, we're just going to shorten this up a bit, not taking, the entire thing, but enough to where he's not banging it in, giving it time to heal up. So what we're going to end up doing here is I'm finding where my joint, what joint I want to go through. So I'll pinpoint that spot, which we're probably going to go right through this one. And then I'll mark that with a needle. So I'll basically find where that joint is, open it up, and basically take a needle and go right through. So that's going to mark that joint. Okay? So you see that there. Doesn't hurt. He's under anesthesia, feels no pain, which is good. Now, the tricky part with this is we also need to have enough skin to close over this. So my incision for this will actually be a bit farther down than where my needle is. That's just going to give me enough room to close the skin over this bone. So we'll make a nice little V incision here. So we're going to start on top, come along the side like so, do the same thing over on this side, come around the side like so. Then we're going to do the exact same thing on the underside here. So actually come up, like so, and then back down. Now what I've done is pretty much make a zigzag. That's going to allow my closure to be able to close and have this tail come to a almost like a point, a rounded tip, just like the tail naturally is. So you see a couple little tendons in here, a couple little ligaments. That's just going to be the distal portion of that tail. And then down deep in here, you can actually see, so you guys can get a little bit better look, but down the middle of this, you'll actually see, so this right here is actually the bone. That's actually a piece of that tail bone right there. So I've got my joint here, I've got another joint here. I'm cutting right over the middle of that so I can then push this skin back, get behind it, remove that portion, then close my skin over that.
Alright guys, so he's now at the point where we're going to completely cut through the joint and take the tail off. And there we go.
So you can see, so that actually, if you're able to see that right there, basically this is what that disc in between those vertebral bodies looks like. How like concentric it looks, almost like a tree ring. All right, very, very classic for that disc. So we actually went right through that joint just like we wanted. Now you can see the effects, after effects of that. So we've got our nice little skin flap, just like so. So now my joint's way back here in the back, okay? So now I've got this extra skin here I can then use to suture closed around it so I don't have any exposed bone or any exposed nerve cords. But first things first, because as we mentioned before, not really a whole lot of bleeding here because we've got this tourniquet up here. If I were to let this thing go, you would actually see in this area right here, got a nice big old vessel on both sides. And then up here at the top as well, have some nice little vessels as well. So we're going to ligate those to make sure we don't have any bleeders once we take that tourniquet off.
Alright guys, so we finished up here, and basically what we're going to do is we're going to release the tourniquet and make sure that there's no kind of issues with bleeding, anything like that. And then we're going to get a bandage on there. Hope you guys enjoyed the video. Thanks for joining again. If you liked the video, want to see more, like and share us on Facebook and subscribe to us on YouTube. You guys have a great day. Thanks.